Hello, students and advisors. We are so glad that you are here for this presentation on the National Library of Medicine Health Literacy Ambassador Recognition Event. We have been working on this for quite a while, and we are so grateful and glad to introduce this as a recognition event.
We'd like you to meet the team. Trudy, myself, Denise, Buffy, and Cynthia. And as Cynthia mentioned, we have worked on this for a long time, and we are thrilled that HOSA picked this up as a recognition event. The U.S. Surgeon General has identified health misinformation as a public health priority. Dr. Murphy, who's the U.S. Surgeon General, says, health misinformation is a serious threat to public health. It can cause confusion, sow mistrust, harms people's health, and undermine public health efforts. And it's here. So no more going to TikTok for your health information. We want you to go to the National Library of Medicine. So our objectives today are to educate health science teachers and health science members and HOSA members on Medline Plus to improve health literacy, to share these new event guidelines so that you will use them for credible research sources, to create very, very cool projects, and to certify as Level 1 and Level 2 National Library of Medicine ambassadors to not only increase your resumes and portfolios, but to improve the health of our nation. So let's go back to the health science acronym soup. NIH stands for the National Institutes of Health. It actually belongs under the Department of Health and Human Services, which is one of the cabinet members of the president's team. National Institutes of Health has the National Library of Medicine, which houses biomedical libraries, and PubMed, which is the professional side of Medline Plus, the National Institutes of Health magazine, clinical trials, Medline Plus, and Connection for Electronic Health Records. So we actually piloted this program 9 years ago in 2015 with the National Library of Medicine. We were approached by HOSA, Dr. Jim Kenninger, who had a working relationship with Dr. Rob Logan, asking which health science teachers actually use the National Library of Medicine. It so happened that I did, and so did some of my colleagues here in Utah. So we worked with them to create this Library of Medicine Health Ambassador Literacy Program. Again, you can see that threefold mission: using evidence-based research, development of health information ambassadors, and development of a HOSA recognition competitive event. So we have had the opportunities to spread the word through several different states. You can see in the lower right-hand corner that we had an opportunity to present in Nebraska. We've presented in South Carolina. We've presented in Missouri, Utah, California, and I'm sure there's others, but coming to a state near you.
Hi, my name's Buffy, and I've been on this journey too for the past 9 years. I would like to talk about benefits of learning how to basically navigate Medline Plus and to be able to deal with all the wonderful I would say benefits that come along with getting this ambassadorship. So access to the correct information. We know that getting the right information is very important. As a health science teacher, a lot of my students come to me and ask me questions, or we all go, unfortunately, to Google to get our answers. And we're hoping that we can teach you the right way and find the right information and spread the word. Being a National Library of Medicine ambassador is really great for resume and interviews. I know Denise has a really good example, but just teaching our students, and I'll let her turn the time over to her, but just learning or teaching our students how to basically use this as an advantage and as information when they go for jobs is something that's been very beneficial. So go ahead, Denise.
Yeah, so I have a medical assisting student who, when the future employers saw the National Library of Medicine Health Literacy Ambassador on her resume, asked her about it, and she told them about it, and the company was so impressed that they hired her on the spot. It's a great way to be able to provide patient education, which of course is a huge part of healthcare. Back to you, Buffy.
Great. It is a new recognition event. We're very excited about this. So this is something where you can earn certifications, and you can also learn recognition. And so that's a wonderful experience. Not only are you learning all this information, but you're applying it into our daily lives and into our employability and to our job. Advisors, these work well as HOSA activities or in class. So this is also a great way to get your whole club and charter involved and learning new information, and again, spreading the word. There's bonus plans that you can do where they can actually get the certification in your class or in a HOSA activity. So this has been very beneficial, especially even using it with all the different tools in our classroom. Students take these activities back. So that's been a great thing. Competition connections. So why do students use NLM? First, there's a HOSA Bowl, and I'm going to turn this time over to Denise. So why do students care?
So as Buffy gave a great lead in there, every 5 to 7 questions are coming from the National Institutes of Health Medline Plus magazine. So you might have noticed if you're on a HOSA Bowl team, it gets really quiet every 5 to 7 questions, unless you've actually been to that website. But now you can have an advantage. Career Health Display is a perfect place to be able to do research on your healthcare career. Extemporaneous Health Poster for the middle schoolers. And you can see the other events there, which Medline Plus would be able to provide great research for any of those events.
And like Denise just stated, there's lots and lots of hostable questions that come directly from this magazine. The best part about it is current, relevant information given. And the best part for me is it's written for the general public. My cute mom was diagnosed with breast cancer here a couple years ago. And of course, the doctor started using big words. And of course, it went right over her head. So the first thing I did is I sent her to this website, and it cleared up a lot of questions for her, which I was grateful for as well. You can view the current and past issues of the Medline Plus magazine and it's still available online today.
The entire program is built on medlineplus.gov. Medline Plus is created by the National Library of Medicine. I know a lot of my students, when they go to find information, the third or fourth tab as you go through and you put in a subject on Google is actually Medline Plus. So it's been a great benefit to actually learn how to navigate this website and to be able to get the right information. And we'll explain that later on a video, but this is what it looks like, the Medline Plus right here. And then we'll explain to you how to navigate all the different areas, but it's been great for them to say, oh, you know what you're talking about. So there is level 1 certification versus level 2 certification. And I will explain, or we'll go further in depth, but this just talks about the actual certification. So level 1 students learn the features and navigation of medlineplus.gov. Students demonstrate proficiency by earning the certificate. Level 2, so they're going to learn the certificate, and once you earn the certificate, then you can get the recognition. But level 2 students learn to apply the information from Medline Plus, and the students demonstrate proficiency by earning the certificate. So the whole point is for both levels is to earn the certification, and then you would go from there. Once members earn that, there are additional requirements to actually earn the HOSA recognition. So there's basically 2 levels, but then 2 recognitions, one for each level.
As Buffy stated, these are just the step-by-steps that we want students to follow. These are also located on the event guidelines on HOSA's website in the recognition area. Essentially, we want students to follow the link in the guidelines. They're going to open one tab to Medline Plus and another tab to the Google form. As they navigate through Medline Plus, they'll be answering questions on the Google form, and this is showing that they know how to navigate this website. As soon as they submit the Google form and they've reached the benchmark competency level, the certificate is going to be emailed to them, and then they'll be able to take what they learned in Medline Plus to create a presentation based on a classroom assignment or on something that they're interested in, or on something that they're using to prepare for a HOSA competition. They will share that competition, or excuse me, share that presentation in either a classroom presentation or in a HOSA meeting. And then they'll be able to upload into HATS. We'll show you how to do that in just a few minutes. Once you've uploaded your presentation into HATS, the advisor will approve it, and then you're all ready to register for that recognition at your state leadership conference or at ILC. Level 2 follows the same pattern. You're going to follow a link in the guidelines and go out to a virtual escape room activity. You'll use Medline Plus, open in one tab, the virtual escape room, open in another tab, and you're going to be answering questions in the escape room based on information you're finding on Medline Plus. Once you finish that, the certificate will be emailed to you. You'll be able to then go through the steps required to create an artifact that could be used either in your classroom or in your community or in a HOSA competition. You'll give a short presentation describing to other students what you did in order to earn this recognition. Upload to HATS, your advisor approves it, and you're all set.
So for your level 1 certificate, students are going to open up one tab, and then in another tab, they're going to open up the NLM Ambassador. This way, they just have to be able to toggle back and forth through the two to answer and to show how, if they know how to navigate the website. And then the certificate will be emailed to you. So how to earn the silver recognition? Just like Cynthia stated, you share your presentation in your chapter meeting or in a classroom setting. I've had my officers come in and present to my class for an example, and then they enter the hours into HOSA HATS, which we will have a video to show you how to do. And then obviously you register for the SLC or ILC recognition event.
Level 2 uses this virtual escape room platform, and I want to just kind of show this to you. We've seen so far that lots of students are completing the level 1 and they get to the level 2 and it's a little bit more challenging. So we wanted to take you out and show it to you. It uses a platform called Deck Toys, and it's going to force you to go through these activities in order, starting right here with the welcome aboard. Now, I'm going to turn the time back over to Trudy because the cruise ship came from an experience that she had, and I want her to share that with you so that you can kind of understand where our Stuck on a Cruise Ship theme comes from.
So picture this. It was the year 2013. We're at our cabin. We're out to sea, and all of a sudden we get woken up by the loudest foghorn I've ever heard in my life. And we sit up straight in bed, and the captain comes on and goes, "We got good news and bad news. We're almost to Galveston," and we're almost to Galveston. We were socked in fog. So therein lies the story of how this kind of came about when you are stuck and you are needing help.
So the scenario is that you're a medical student and you're on this cruise ship that can no longer come into the port at Galveston. You're stuck out at sea, and there are multiple shipmates of yours who are now starting to suffer from some different medical conditions. The medical staff is overwhelmed, and so they come to you as a medical student asking for help. And as a medical student, you're going to reference Medline Plus in order to help these patients on the ship. So as you work through this, there are different cases, and you'll read the case. They're written with standard SOAP notes. You're going to answer questions. You're also going to be unlocking locks. There's activities in here where you have to get every single one correct. I will give you the hint that you need to read every pop-up. I think we're so conditioned to just close a pop-up, and those pop-ups might just have some clues for you as to what codes you need to enter on the subsequent screens. So we know that this is a challenging activity, but it's also a fun and engaging activity. Our students love it. And one of the things that I love about it is it helps them build some of that grit and resilience that we know our employers are looking for. So again, we're helping build some employability in you as students. So don't give up on it. Trust me, the answers are there, and the answers are correct. We do go through the activity about every 6 months and verify that Medline Plus hasn't made a change in their platform that would give you incorrect information. So stick with it. One clue, and this is listed in the guidelines, is you can do this with somebody else. Again, teamwork skills are being built here. Communication skills are being built here. So you're welcome to do this with a friend. You just are both going to need a computer open, and you're both going to need to be able to submit the deck in order to both earn the certificates. This is what the certificate looks like that will be emailed to you upon your completion. And once you're finished with that, there are a whole variety of options for your artifacts that are listed in the event guidelines. One of the things we really want you to do with Medline Plus is apply what you've learned and share that. So you are maybe working in an internship in a physician's office as part of a program, and maybe you decide to have a conversation with that physician. What are the needs? What maybe handouts or posters would they like to have? Medline Plus has a variety of information in a variety of languages. Maybe there's a language barrier in the office, and the physician would like you to be able to pull some of those resources that then they can use in their office. All of these are artifacts that could be used for your gold level recognition. Again, once you complete those, you'll share that with your other members of your HOSA chapter, and then you'll enter that in the HATS system. This is just a quick video that's going to show you how to enter your recognition in the HATS system. This brief video is a tutorial to help you navigate the HOSA HATS recording system. This is the system in which you will upload your certificate hours and also your presentation hours. Your advisor will then approve these hours. These hours need to be approved prior to you applying or registering for recognition at State Leadership Conference or at International Leadership Conference. After completing your certificate and your presentation, follow the link located at number 17 on the guidelines. This will take you into the HATS system. Click on that link. Now, before you can enter any information here, your advisor needs to have registered you in the HOSA CMS system as a HOSA member. Once that has been completed, this process will work. Enter your name, enter your charter number, which you can get from your advisor, enter the date that you completed your activities, enter the activity. As per the guidelines, if you are working on a certificate, you'll enter completed level 1 silver certificate. If it is the level 2 certificate, it'll be completed level 2 gold certificate. If you are entering your presentation, it would be level 1 silver presentation. If it's the level 2 presentation, it's completed level 2 gold presentation. The activity code is Health Literacy Ambassador, and then you'll enter your hours. For your certificate, enter 1 hour. For your presentations, enter the number of hours that you spent engaged in either creating your presentation, in giving your presentation, or in completing the activities that you used for your community. Hit save and you're all done. These hours will go to your advisor for approval. It's that easy. Now, advisors, if we have any of you on, we have a quick video for you. This video is a tutorial how to approve those hours for your students. Hello, advisors. This brief video tutorial will show you how you can go in and approve the activities that your students have created for the Health Literacy Ambassador program. Click log in and log in the way you normally do to enter your membership. When you're in the membership screen, you'll go up to membership, click on activity review, and then you can search by either the Health Literacy Ambassador or by activities that are pending. Then your student activities will pop up. If you can verify that your student has completed the activities, you'll simply click the green check. If you are unsure if they've completed those activities, you can either have the conversation with your student or you can decline them. Once those activities have been approved, your student is ready for recognition at your state leadership conference and or at international leadership conference. Okay, this is your invitation now to get involved. We hope we've given you all the tools you need for success, and we just want to share the good news about Medline Plus. There's so much information there. Whenever I go there, I end up going down a rabbit hole and searching all kinds of fun stuff. So we want you to get involved. We want you to become a Health Literacy Ambassador. We want you to read the guidelines. We want you to test it out, and we for sure want you to share it. If you have any questions, please feel free to reach out to any one of us. We are here to help. Good luck. We'll see you at ILC next year.